So, welcome back to the ultrasound teaching session. This is about musculoskeletal ultrasound today. Thanks, Hayden, for agreeing to be our subject today. So this is a lot of our work is acute fracture care, and Hayden's back after 10 days. He's got a fracture of his distal radius. That's the end of the radius, Hayden, and he's come back for a check. We're taking the cast off and we're doing a position check because he had a fall on the cast and we like to make sure it hasn't displaced. Instead of sending for an x-ray, we like to just put the scan on. So we haven't done this yet, have we? So I'm just going to put some gel on here, Hayden. Just goes along your arm like that. Whoops, feels cold. Then we take the probe and we're just going to put the probe on. You guys might want to see this if you like. We'll get Mum to have a look as well because she'll want to know what this looks like. So we put it on the skin and the longitudinal plane right on the dorsum, and you can see the distal radius straight away, and you can see the fracture there as well. So you get a sense very quickly how easy it is to see the fracture.
So it looks like we'll make this a really quick tutorial, this one of the everyday ultrasound tutorials. This is really all about checking position with an ultrasound scan. These x-rays are the original ones. They're taken a week earlier. You know, you get your child in, or your patient in, they've got a fracture, you're going to treat them, you decide what to do. After a week, you want to bring them back and make sure they haven't slipped. These fractures in particular, you can see on the lateral where there's already a bit of angulation. These can easily continue to angulate even with splinting or casting. So you need to check them after a week. You can see a pretty nice position on the AP, and it's the lateral that we always have these dilemmas about. We're discussing endlessly, how much angulation to accept. You get a little breach of cortex there. It's more vulnerable to carrying on to angulate further. The point is, for this tutorial, is you can see the angle on a scan. So you can get them back at a week, scan them, measure it on the scan, freeze the image, put your measuring instrument on there, and decide whether it's acceptable or not. And I'll leave that up to you to decide in this case. And certainly the scan option is very quick and just as accurate, and I like it for avoiding those x-ray unnecessary radiation in children, unnecessary delays as well. Thanks for listening.